A very good morning to one and all, and welcome to this webinar on COVID care, specially designed by Tata Realty. My name is Hardik Shah, and I take care of marketing for Tata Realty. So, just to give you a context as to how and why we thought about this webinar, Tata Realty has about 54 properties across 15 cities in India. And while we have taken several safety measures for our 20,000 plus residents, the construction workers, the staff, we still sense a lot of anxiety over the uncertainty that COVID-19 brings with it. So, in terms of what's coming up next in the COVID journey, the possibility of a third wave, how will it affect our children? So we thought what better way to allay all these doubts than to gain knowledge from a credible source. And so we have the privilege of having with us Dr. Rahul Pandit. So Dr. Pandit is a director of critical care at Fortis Hospital, Mumbai. He's been appointed by the Honorable Supreme Court on the National Task Force on Oxygen. He's a member of the COVID-19 task force in Maharashtra and has been instrumental in creating the treatment protocol for the COVID patients in Maharashtra state. He is a visiting consultant of ICUs of several renowned hospitals in India and abroad. He has had more than 30 original publications, book chapters, and 500 plus lectures and scientific presentations to his name. He's been recognized for his contribution by the American College of Chest Physicians as a fellow of College of Chest Physicians. He is an MD in anesthesia from Grant Medical College and JJ Hospital. He also holds a prestigious fellowship of the Australian College of Intensive Care Medicine, and he also has a diploma, a European diploma in intensive care medicine. Dr. Pandit, very grateful to have you here with us. I think I'll start with asking you to give us a very macro view of things. I would request if you could start by helping us understand where do we stand as a nation in this COVID journey and how much more is left to be seen.
Mr. Shah, thank you very much. Thank you very much for your kind introduction. I really appreciate you calling me here and giving me an opportunity to speak with the Tata Realty community and family, Tata Realty family rather than community. I would like to call it family. And I think this is a very pertinent question which you asked, that where are we currently as of the June 2021 in our COVID journey? Now, it's unfortunate that we are actually calling it as a COVID journey, but that's unfortunately the reality as well, that we are going to have this journey continued, and we have been sort of a part of this journey for the last 16, 17 months or so across the world, across the globe. And it is very important for everyone to understand where do we head after this. So currently, the nation as such, India as such, is actually slowly limping itself back from the second wave. Many of the northern as well as western states have had the COVID wave on a descent. However, there are some southern Indian states where it probably has just peaked and may start showing a fall in a few weeks' time, in a week or two's time. And obviously, the eastern part of the country is still having small pockets where it has not yet peaked up, or maybe it will peak up and start coming down in a few days' time. As a overall number of cases and test positivity rate, these are the two epidemiological parameters which we doctors use to understand where are we heading. Now, overall numbers are very easy to understand. Overall numbers, there were 4 lakh people who were approximately coming positive around 2 weeks ago, 3 weeks ago. They have fallen well below 3 lakh people now, so which is good. And you also had a test positivity rate, which was in the range of around 20%, which means that behind every 10 tests which we were doing, around 2 were coming positive, which is a very high number. Normally, we say that pandemic is under control when that number falls below 5%. Okay, so districts like Mumbai, Thane, Delhi, the test positivity rate has come down below 5% already. So this second wave actually came as a tsunami, literally hit us as a tsunami. We were completely overwhelmed and stretched in terms of our mental ability to cope with it, in terms of our physical ability to cope with it, and our infrastructure to cope with it. So it sort of hit us in all directions. Okay, but by the fortune that it actually came very rapidly, in the same way it actually went down. That's the fortunate part of it. Okay, though it is
Right.
all sadness in that whole 3 weeks, 4 weeks period, it was full of sadness, but it did
Yes.
not linger on with us. That's the only good thing about that. Okay, and I think we have been a little bit lucky that it did not linger. It sort of came down very quickly. Now we are in a state where we are okay in terms of our infrastructure, and we are actually probably going to be fine in terms of our human resources and manpower to look after these patients as well. But we are nowhere near normalcy. That is the most important point to understand. We still have a significant amount of patients. 1.5 lakh to 2 lakh patients is a large number of patients which are there in the country. States like Maharashtra, Karnataka still have around 15 to 20,000 patients across the state which are spread out. And our test positivity rate for the country has not yet come below 5%. Okay, so I think a few more weeks, by the end of July, hopefully we will be in a much comfortable position than what we are right now. We are certainly heading in that direction. Now,
Okay.
for all our friends and families here, I would only take 2 or 3 minutes to explain what is expected from us. Every time a wave comes, the first wave came in and it sort of disappeared by October, November. Definitely, we were looking like we were back to a very, very normal lifestyle. People started going out, attending weddings. People started having get togethers. School and colleges to be opened or not, the question started being raised up. Some of the colleges and schools indeed opened up as well. But that 2 or 3 months of good time did not last long, and as soon as it came as February, we again started having a rise in the case. So what went wrong in between that was we became complacent. Our COVID appropriate behavior, which we like to call, I may be repetitive in this, but I think it needs to be emphasized again and again that COVID appropriate behavior is the only vaccine today which will help us from having the effects of a third wave blunted down. So the in turn, what I'm trying to tell you is that a third wave, will it come? It is natural to come. Okay, 100 years ago it had come. Europe, many countries, America, many states actually experienced a third wave. So it would be naive to think that India is going to be shielded from the third wave. But what many countries did was that they ramped up their vaccination program between the second and third wave. And they also emphasized with information, education, and communication about COVID appropriate behavior. So, double masking when you are stepping out of the house, single masking when you are in your home if you have a person who is suspected to be positive. If nobody is positive, everybody is healthy, you don't need to wear a mask at home. But when you're stepping out, double masking is compulsory. One surgical mask, one cloth mask, or two cloth masks. If you're a doctor or a healthcare professional, N95 mask is enough, then you don't need to double mask. Unless you're going in the COVID area to see a patient, then obviously you need to double mask with the N95 as well, just to add that protection of level. Avoid crowded places. If you are in a profession which allows you to work from home, continue to do so. If you are in a profession which allows you to make your timings flexible so that you actually go to the office when the crowd is less, do so. So try and avoid crowded places. Try and avoid your interaction with too many people. That's going to be the best social way to actually mitigate the third wave to a larger extent. How long will this continue? If you ask me, the vaccination program for the country may take up to December to be completed. But remember, in January, we got vaccinated as doctors. So we are probably going to start vaccination again in January for all of us, most likely. Okay.
Okay.
So it's going to be an ongoing circle, it's going to be an ongoing cycle. And even if you're vaccinated, you still could be positive. You may not have symptoms, you may be mildly symptomatic, but you can certainly spread it to other people who are not vaccinated or who are vulnerable. So masking is going to remain with us till at least 31st of December 2022.
Okay.
Please remember that. Masking is a part of our lifestyle, will remain with that. But we don't have to panic. This is, if we just make that as a part of our life, just like I'm wearing glasses, it doesn't bother me anymore. If you start wearing mask and take it and accept it as a part of your life for next 15 months, 16 months, trust me guys, 1st January 2023 will be sunshine. Nobody will need to wear a mask because by that time everybody will be vaccinated at least twice and the virus would have gone. But that's what we need to do as a nation. We need to protect ourselves as a nation, as a country, as a globe, in fact, as a whole world. In fact, that's what we need to do. So, this was my opening understanding of where we stand currently. I would be very happy to take questions or the way you would like to play across. If you have any specific things you want me to elaborate on, Mr. Shah, I'll be
Yes,
happy to do that.
yes, doctor. So thank you, doctor, for that ray of hope. January 2023 is what everyone will be looking forward to. Until then, we will take care of whatever you've advised. Now, I'll just we've received a lot of questions. What I am doing now, I am making a bunch of questions, and then I'll present it to you one by one so that most of them are
Sure.
covered. Yeah. So, getting into the specifics, the latest question that's been coming around is, does coronavirus being airborne change things for us? Because a lot of news articles around coronavirus being airborne, and what precautions should we take, especially coming from residents, because we have a lot of open spaces and multiple kids play areas in our projects. So this whole thing of it being airborne, can they travel by lifts, and what precautions should they take, and should they not even get down and come down to the gated development? Can they at least play within the development, putting the mask on? Can my child go out and down to play? Those are the kind of questions.
Yes, I think they are very important questions to ally their fears about this. So let's take one step at a time. Is corona really airborne? Okay. Yes, there was a publication in Lancet. We've always thought of it that it could be an airborne problem as well. And there was a publication in Lancet which said that these droplets which fall out from people who are infected and they sort of settle on the furniture, floor, whatever your surrounding area essentially. Once it dries off, a gush of wind may actually blow it a little bit away. So up to 10 meters, 7 meters, 10 meters is what they actually found that you could actually blow away the viral particles. Okay. Hence, it is important that we need to be having precautions of that. Now, what are the precautions? You cannot stop a child from growing. You cannot stop a child from playing. You cannot deprive a child of a sunshine because that all things are important for their physiological development, their physical development. You need vitamin D to grow. They need to go out and have some form of a free time. But within the confines of the rules that we could set for our children, I think if we can allow them to play, I think that will be fine. So you may have to develop some innovative ways within the compound, within the community, to sort of help and get these children to play together and for your other people, the adults, to move around. So what's the thing which adults can do? If they double mask when they're stepping out of the house, they need not fear about anything. As long as they keep their mask properly and keep a small bottle of hand sanitizer with them, they can travel by lifts, they can go down, they can sort of interact a little bit with some amount of social distancing with friends in the community, 3 to 6 feet of distance at least between the two when they're talking, with mask up all the time. That's one rule. Secondly, when you're doing this, some form of a common sense is important. So, what's the common sense? If the lift is meant for 6 people, reduce it to half when you're traveling. Make sure everybody is wearing a mask in the lift so that they can be safe. Now, adults can obviously follow these rules. Children above 12 years old can follow these rules. The problem happens for children below 12 years of age. Okay. There is no guarantee that they are going to keep their mask on. There is no way that you will actually be able to make children below 5 or 6 years of age understand the importance of masking. But trust me, whichever children I have come across, they actually are very, very clever. They try to imitate their parents. So if their parents have the mask on, children will do that by example. that they are actually seeing their parents do it. If the parents talk in front of children that this mask is irritating, this mask is something which I don't like to have it on my face, it stops me from breathing, children will feel the same way, especially the ones who are dependent on their parents completely. You may not be able to influence those about 12 years of age. They will have their own opinions because they're teenagers. I have a teenager daughter, so I know that opinions, they can form their own opinions. But especially the younger ones, they actually try to follow their parents. So if they're going to go down, try and play, make them make them play the sports which may involve playing with their brothers and sisters if they have brothers and sisters at home, or if they're the only child, then maybe cycling, running, those kind of hobbies you may have to inculcate for some time. Contact sports where you require people to be together and play may actually be a little bit worry to be done right now. Until that, see, even now is not the time to do it. When the numbers come down, absolutely, that may be the time to think of it. Remember, children vaccination below 12 years of age is not going to come very quickly. It is going to take a long time before we'll have children below 12 years of age vaccinated. Between 12 and 18, the trials have already started, and you may see the light of the vaccine coming for that age group very shortly. Now, what's the silver lining? Just one more addition to that. What's the silver lining in all of this? The silver lining in all of this is children below 10 years of age have got a thymus gland, which is just behind our thyroid gland present. It becomes a little inactive as we grow up. But for those children below 10 years of age, it actually gives them a very good T cell immunity. So you would find that children, though they may get infected, they rarely become symptomatic. So they have mild symptoms like a cough or a cold, and usually they get better. You would not have heard or seen a large number of kids below 10 years of age getting into the hospital. Yeah, you will always have one or two examples. I'm not denying that. But majority of the kids don't do that. But unfortunately, because they are so sweet, we all like to play with them, they become super spreaders. Because they go and play with the adults. Adults pick them up, they play with them, they
Right.
tend to become super spreaders. So it's important to understand these 2 points of that.
Right. So, thanks, doctor. One more question is by Uttam Kumar. In fact, he's posted much before the webinar began. He's asking how to recover fast post-COVID infection. So, to make this into a whole question, we are seeing a lot of questions around what, in your view, could be a complete recovery from COVID, because people are facing lung infections and a lot of things after COVID. So, how does one recover fast?
Yes. So look, one of my colleagues, which me and Anuruddha work with, Dr. Sashank Joshi, he has a very interesting way of talking about the length at which COVID infection continues, and that is for a period of 2 to 3 weeks. He likes to call it as COVID timetable is of 2 to 3 weeks. Okay, so it's not like the COVID is getting better within a few days time. It sort of continues for 2 to 3 weeks, and that's a nice way of saying that COVID timetable is of 2 to 3 weeks. But what problems we face, it may go beyond 3 weeks, and that's what's called as a post-COVID infection or post-COVID recovery, which Mr. Uttam Kumar is alluding to. And we also like to call that as long COVID, or we also like to call that as post-COVID syndrome. Okay, these are the medical terminologies we come across. And the most common factor from that is a weakness or a tiredness or a sense of being tired or weak all the time. And that can continue for months together. Okay, and that is because of the viral infect which has on your body, which makes it feel that it is because it's weak and it is tired all the time. What do we do for this? How do we actually recover? So one of the things which is important is that you need to have a few things in your mind when you have COVID. First and foremost, do not be over enthusiastic and say कि मेरे को कुछ नहीं हुआ है, I've got nothing, I'm going to be fine. Okay, accept that you have COVID. First point is acceptance. Accept that you have COVID, which has a potential to keep on lingering for some time. So first is follow your doctor's advice when you have acute illness. Make sure that you do all the right things what your doctor did, what your doctor says. Follow up with the doctor as soon as the symptoms come up. Right now, if you have any symptoms which are flu-like symptoms, they are because of COVID-19, unless proven otherwise. If you have that clear in your mind, you'll go to a doctor. Don't say that I have never stepped out of my house. Why would I get COVID? Or I've never met anybody with COVID positive. Why would I get COVID? Rule it out, be assured. So visit a doctor. Second, when you are sick, aim for a nutritious diet, good 8 hours of sleep in the night. Digital detox is very important. Stay away from WhatsApp news, stay away from the news which only talks about COVID. Stay away from webinars like us right now, we are only talking about COVID. Sleep, read books, enjoy what you do, what you like the most. For example, music, reading, whatever it could be. Okay, movies at times, but stay away from just COVID and COVID cluttering news. Once you are better, a little bit of exercise is important. That doesn't mean that you start doing gym. The best exercises are the breathing exercises. So those who are in a hospital, the doctors usually give them some breathing exercise with a ball or a incentive spirometer to breathe with. If you are not in a hospital, a little bit of pranayam, a little bit of deep breathing exercises. I'm not asking you to follow any yoga pattern or anything. I'm just asking deep breathing exercises, maybe a little bit of balloon blowing exercises. These small things you should start. Don't aim for a very high target. Your aim should be that you should not get tired at the end of exercise. So I generally ask my patients to start walking for 5 minutes a day at a own pace. Don't exert yourself. And every 2 3 days, build on another 5 minutes to it, so that by the end of 1 month of COVID-19, you are able to walk at a leisure pace for around 25 to 30 minutes. That should be your target. Okay,
Right.
that leisure pace. You are not going to walk brisk. You are not going to go to gym. You are not going to start doing your lifestyle of cycling and pumping up iron into the gym. You are just going to maintain a simple exercise regime, good night's sleep, timely eating, nutritious diet. No amount of vitamins is going to replace all of this. You may take any number of vitamins, but these basic rules have to be followed. And trust me, if you do this for a month or two, you will be completely recovered from COVID. Long COVID and all, none of these problems will bother you.
Right, sir. So the next question is from Ipshita Rath. It's a very specific question. My father-in-law is not a sugar patient. However, after COVID, his fasting sugar is 50, and post meal it is 203. So does he need to take medicine?
Okay, so Ipshita ji, I think your question is very important one, because what we have seen is that a lot of patients who were non-diabetic before or who were in a pre-diabetic state before have now got post-COVID diabetes, and it is a known entity now, post-COVID diabetes. So my suggestion is go and meet your family doctor. Your father-in-law sugar needs to be controlled. 230 post meal 2 hours is a very high blood glucose level. It needs to be brought down to around 120 to 140. Okay, and that obviously can't happen very quickly. It needs to be done over a period of time, and you will have a multimodal approach. Your doctor will have a multimodal approach with that. He or she would advise you on a diet. He would advise you on do's and don'ts in what you can eat and what you shouldn't eat, what he shouldn't eat, beg your pardon. And then the medicines, obviously, which will have to be taken up. But do keep an eye on the blood glucose, because some of the times what happens, and I don't know whether you've not mentioned that in your post, is your father-in-law on steroids right now? And if he's on steroids right now, the moment you stop the steroids, your sugar will come normal. So do visit your doctor and bring this to his notice. If the steroids are not there, he definitely needs to be looked after. If steroids are there, wait for the steroid course to get over. In that time, in the meantime, you can have a little bit of a sugar control by 1 or 2 tablets, which the doctor will give you, and then again review the whole situation once the steroids stop. So there is a if here. If you're on steroid, you have a different plan. If you don't have steroid, you have a different plan.
Right, doctor. Another question. Again, I'm grouping a few questions. This is for the stage during COVID. So, what exactly is the point when we should decide to go to the hospital? So, I'm asking this because there seems to be a rapid disease progression and pneumonia, including in the young, unlike the first wave. So, which is that exact point when we should decide to go to the hospital?
Yeah. So I think again a very important question, Hardik. When you do have flu-like symptoms, the first thing you need to understand is get yourself tested. so that you know that you're positive and then you know what to do. That's one thing. When to report to a hospital for admission or go to a hospital. So you should be never be unmonitored at home. All patients who have COVID-19 should be in contact with a healthcare facility or a healthcare professional. He could be your normal GP. On a phone, you need to report to him every day what the blood pressure is, sorry, what the blood saturation is, what the temperature is, and if you have diabetes or something, what your blood sugar is. These three things need to be reported to the doctor every day.
Right.
Now, there are specific things which you can do, which would help you understand when you should report to the hospital, because that's a very important point you should not be missing out. So, every patient of COVID 19 should monitor his temperature 3 to 4 times a day, should monitor his saturation 3 to 4 times a day, and should do a 6 minute walk test morning and evening, no matter what the age is. If they are old and are not able to walk for 6 minutes, then a 3 minute walk test. I will tell you what a walk test involves. Walk test is you do a saturation with a pulse oximeter on a middle finger or the first finger, index finger, at rest. Note down the saturation. The saturation should be above 94%, and essentially you should not be feeling any breathlessness at that time. If you're comfortable, take a walk within the confines of your quarantine room for 6 minutes at a very normal pace, at your own pace, leisurely pace. At the end of 6 minutes, repeat the saturation again. 30 seconds after you put the probe on, see what your saturation is. That would be your normal saturation. And if the saturation reported after 6 minutes of walk has fallen below 93%, or there is a 3% or more absolute fall from the baseline. For example, your baseline was 98 before you started walking, and it has now fallen to 95 or below. That is the time to report to the hospital, not when you have become hypoxic, because that gives doctors time to give you the right medications, which at this point would be steroids, and they will be able to help you with that. That's one way of reporting to the hospital. The second way of reporting to the hospital is that we are seeing a lot of patients now in the second wave who have a biphasic illness. So first 4 or 5 days of flu-like symptoms, where they have a little bit of body ache, temperature up, and all those things, and then they have a couple of days or 3 days where they feel better, and at the end of seventh or eighth day, they start having fever again. And if that fever is high rise, is high grade fever, or throughout the first 7 or 8 days your fever has not subsided, please go to a hospital. Please go to a hospital. You need to be in a hospital at that time. And the last but not the least is that in a COVID patient, if the timetable is of 2 to 3 weeks, every fourth or third to fifth day, you should repeat your CBC, CRP, and D dimer. If you see a rapid rise in any of these parameters, do consult a doctor, your own doctor, and bring it to the notice that this is what has happened. He may advise an admission. This is a may thing, this is not a definite thing. But the first two scenarios, definitely you need to understand and you need to report to a hospital at that time.
Children also, because I've got a question from Mr. Mohammed. He says that in most cases, kids pass through COVID, but post-COVID issue arise like fever and rashes. The doctor recommends steroids and DDMR tests for a few weeks. So how can we ensure they don't get into health issues later due to steroids? I think it's a concern around steroids.
Right. Look, I think in children, usually you would not have. So, if this question by Mr. Mohammed is about children, usually they will not prescribe steroids for a long time in children. There would be very short courses of 3 to 5 days, and that is fine. I think that's what it should be given for. Any steroids beyond 5 to 10 days during any course of illness for COVID-19 is a red flag for problems with steroids. Short courses are meant to be given. Okay, I am not a pediatrician, but if the patient does have, the child does have these symptoms, and a doctor recommends you 3 to 5 days or maybe 7 to 10 days of steroids, that's well within the range of a prescription which they can be given. But anything beyond that is unusual, and then you need to think that why am I been having steroids, been prescribed for more than 10 days, because that's not what you would be doing.
Right. Doctor, the next question is from Yatin More. Remdesivir, which was clinically line of treatment till April 2021, is now life-threatening drug COVID-19 patients, and he's asking why.
Remdesivir, which was clinically line of treatment, is now life-threatening drug COVID-19. Absolutely not. That's a wrong statement. It is not a life-threatening drug. It is very much a drug which can be used and which probably should be used for patients who are moderate or moderate to severe. I will tell you why. There are all sorts of rumors. Let's clear the rumors once again. So Remdesivir does not save life. It is absolutely clear. It does not change the mortality. So I'm very clear about that. I'm not mixing my words. It does not save life. But given at the right time to the right patient, it will shorten their hospital stay by 2 to 3 days. And if I can send a patient home early by 2 to 3 days in today's time, it serves two purposes. Obviously, the patient goes home early. Two, a bed is available in these times where the beds are a premium right now. And a lot of patients who deserve to be in a hospital were treated at home in the second wave. So if we can make a bed available for them easily, that's good. And three, by sending a patient home early, I'm also less exposing that patient to risk of hospital acquired infection. So these are the benefits from the patient's point of view. From a doctor's point of view, when should I be using it? You should not be using it for patients who are mildly symptomatic or asymptomatic. It's a no-no for those patients. It doesn't help them. You should be using it for patients who have moderate or severe disease. They should be within the first 10 days of their illness. After 10th day of their illness, it should not be used unless it's a very specific group of patients where you may choose to use it up to 14 days. And those are the immunocompromised patients where we know that the viral replication will continue for another day, few days after 10 days as well. And it should not be used for patients who are very severe and sick in multi-organ dysfunction and who are beyond 10 days of their illness. These are the rules around which. So it's definitely not a life-threatening drug. It can be safely given by doctor's prescription in this select group of patients.
Right, doctor. Doctor, the next question, one question from Kanakraj. Can coronavirus spread through toilet vent or the STP? I think is this around chances of transmission through water?
What is STP? Sorry, STP matlab?
Even I think it must be sewage treatment plants.
Sewage
STP.
treatment plant. Okay.
Mm.
So the question is that can it spread through toilet vents and
Or
STP? Yeah. Look, I don't think so. Sewage treatment plants it definitely won't. Now toilet vents, I think most houses have got enough space between the two toilet vents, between the two houses toilet vents. I would not bother about that. Moreover, once the human feces gets or urine gets flushed through the water, the transmission does not happen. In fact, there are studies which we do by actually taking some sewage samples and looking at the test positivity rate in a particular area. So that's another way of epidemiological surveillance which the doctors do, epidemiologists do. They may go and take some sewage samples from a particular area and see how many viral copies are we actually looking at. So that's another way completely, but don't worry about this. The STPs and this will not cause any problem.
Thanks, doctor. Doctor, another question from Harish Purohit. I think this out of some impatience, maybe chest spasm and airway hiccups while talking at length. How long do they persist?
Yeah. So what COVID-19 does is that COVID-19. So there has always been pneumonia. Let me just take one step back. Okay. There are two lungs. Each lung, right side has got three lobes. Left side has got two lobes. That's how our anatomy is. Now, what happens is that when we used to have the traditional pneumonia, it would affect the lobe or one lung completely. Okay, so all three lobes may get affected. But in COVID-19, we have a subpleural affection. That means lung is covered by a pleura, which is a protective membrane, which sort of is very close to the lung. And whichever part of the lung is getting affected is actually the one which is closer to the pleura, not closer to the center, but towards the periphery. So when you're breathing, that rub or friction happens over the pleura. When you're breathing, when you're talking, when you're giving long talks or cough, and that induces these spasms and cough. So generally, most of them will settle within 14 to 21 days. However, post-viral illness coughs can remain for month and a half. But don't ignore it if it persists beyond 4 weeks, please get yourself checked again, because at times you may be looking at some other problem as well, which we may need to investigate.
Right, doctor. Again, doctor, getting a lot of questions around kids. How do we identify the symptoms among kids? So we hear cases about even infants getting COVID-19, and could you tell us how to identify the symptoms? And maybe you could tell us what percentage of your patients in ICU are children?
So I'm not a pediatrician or a neonatologist, but I can tell you in my hospital, we have looked at around 5,500 plus all admissions since the last 1.5 years since the COVID pandemic. So 23rd of March, we started accepting patients last year for COVID-19. Okay. Not one kid in the ICU. No kids in the ICU. But yes, we've had kids in the second wave come and get admitted in the wards and come and go home. Now, most of the kids will have flu-like symptoms. So they may have a sore throat, they may have fever, they may complain of body ache. You may find that the child is getting a bit tired. Sometimes the children just don't complain and they just fall asleep. And they need to be sort of asked what symptoms they have. For children who are smaller, who are younger than 2 years of age, or who are infants, excessive crying, fever again, cough, runny nose, these would be the signs and symptoms which you would be looking at. Rash is very common in children, and one of the complications which children is talked about is the monthly inflammatory syndrome or a Kawasaki like disease, which has been reported. But as I said, in my hospital I have not seen any. Across the city of Mumbai, there have been a handful of cases reported with this complication. So again, my assurance to your family members of Tata Realty, please don't panic. We are talking about this third wave causing a problem. We are talking about this third wave giving rise to more infections in the children. But adequate precautions from our side and all the precautions which the government is taking, if we just use them to the proper spirit with which it is being actually delivered, trust me, your children will be safe and will have no problems. Absolutely. So don't get worried to the point of, you know, depriving the child of simple things. But at the same time, keep your vigil on. Do not brush any symptom under the carpet. Get it investigated by your pediatrician, and your child will be absolutely safe.
On
You're
children
on.
is, sorry.
Sorry, I could not hear the first part what you asked.
One more question on children, doctor. Is it necessary that we give them flu shots? Because with the incoming monsoons, is a lot of
So
fear around it.
there
Can
was
we
a
keep them and can
controversy
we give
around it.
other vaccines also? Sorry.
So there is a controversy which came out around it. Let me just clear it up right now. So the routine vaccination program for children should continue uninterrupted. Please don't stop your routine vaccines. Whenever your child is due for a vaccine, please go ahead and give the child the vaccine. Now, flu shot. You really can't go wrong with the flu shot. Okay, you can take it. There is no problems. Absolutely. Ask your pediatrician and you can take a flu shot. But to advise that as a part of national immunization program, because all children vaccination is national immunization program. Okay, you need to give something which will benefit out of it. Now there are some papers which have talked about COVID-19 infections seen lesser in children who were vaccinated with flu shots. These are reports. They are not well proven strategies currently. These are just reports which have sort of given rise to this hypothesis. As of now, the evidence may not be to give a recommendation as a national child immunization program to be including a flu shot. But yes, you cannot go wrong with the flu shot. It's only going to be fine if your child takes a flu shot. It's going to be fine, absolutely. So go ahead and speak with your pediatrician and you can take a flu shot.
Thanks, doctor. Doctor, a question from Mahantesh. My relative is being admitted for more than 25 days. Still, he's on low oxygen requirement and he's still not able to recover due to oxygen saturation less than 90%. Normally, how many days it usually takes in such cases?
So, Mr. Mahantesh, this is a very difficult question to answer without knowing the details. But what I have seen is that patients are taking months together to improve. Certainly, this category of patients who have been on oxygen with requirements of oxygen on a very high level beyond 3 to 4 weeks have got a very long stay in the hospital to go further before they recover. Majority of them will recover, some of them will not recover despite so many days. So please speak with the doctor of this patient and understand which part of the process of recovery is in. Is the requirement of oxygen improving every few days? It's not going to improve every day. Every few days, if it is increasing, then that's an encouraging sign. But on the contrary, after 25 days, if the oxygen requirement is worsening or increasing, then it's a sign of a worry.
Thanks, doctor. Another question is from Amit, more on mucormycosis. Black fungus infection may be possible in post-COVID. How can it be diagnosed in the early stage?
Yeah, so black fungus infection is definitely possible in post-COVID in patients who have uncontrolled blood sugar or uncontrolled diabetes to deal with. Most patients who don't have this problem will need not worry about black fungus. The first and foremost important thing is to be aware of what are the changes happening because of black fungus. So you usually get a dry nose which is only on one side. You usually will get a pain around the eye or just below the eye on one side, and you may start getting a little bit of a swelling on one side. So if it's a unilateral problem, please speak to your doctor. Black fungus is actually called as mucormycosis in our medical terminology, and it actually does not look black at all. It's a lesion which causes inside the body, which looks like a scar, which is black in color. Hence, its name is called as black fungus.
Right, doctor. Doctor, questions around vaccination. How do I understand whether or not I have developed immunity after my vaccination? And what if the vaccines that I've taken I have not developed immunity?
Okay. So first and foremost, if you are a part of your vaccination program, please do continue with the regimes which have been currently approved in the country for whatever vaccine program which you have taken, whether it is Covishield or Covaxin, whichever it is. That's one part. Secondly, there is no need to go back and test for your immunity or your antibodies. Please don't do that. Usually, most patients will be responders, and the response will vary between two individuals. And what we need to check is the neutralizing antibody fraction, which 90% of the labs are not giving. They are giving a spike protein antibody, which correlates very closely to the neutralizing antibody fraction. But you know, you don't worry about going back and checking whether I have got immunity or not, especially with the variants happening right now, variants of concerns happening right now. Leave that for the epidemiologist. Your job is to take your vaccine when your turn comes.
Right, doctor. Thanks, doctor. Next question is from N. Kumar, again on vaccination. Could a pregnant woman take vaccination more so after, and the other part of it is more so after vaccination, when could one get pregnant if you're planning?
Yeah. So after vaccination, one could get pregnant after 3 months' time. There is no problem, absolutely. So that if you want to plan a pregnancy, that would be a right time to do it. Uh, Pregnant women can take a vaccine. Absolutely no problems about that. Lactating women have been allowed right now. Pregnant women, some centers are doing it, some are not doing it. I think pregnant women, especially those who are working as frontline women, like doctors, nurses, or they are in a bank job where they need to interact with people, I think they should definitely, they are pregnant, they should definitely get vaccinated. No doubt about that. The Indian Association of Gynecologists and Obstetricians, which is called as FOXY, has strongly recommended that women who are pregnant should not be discriminated because they are pregnant. They also need to be protected and they should be vaccinated as well.
Thanks, doctor. Again, questions, a lot of questions on vaccination. Mr. S.V. Pavan Paleda, Pfizer vaccine has shown much better results compared to other vaccines produced by India. Is this true? Again, question. One more question. I'll just ask together. From Mr. Dipanjan. I'm in South Africa. We have a choice of Sinovac, Pfizer, and Covishield.
Okay, good. So yes, Pfizer vaccine, the mRNA-based vaccine, has got good efficacy around to the tune of 95% as compared to some of the Indian vaccines. But Indian vaccines are not inferior. They are just different base vaccines. We have a adenovirus vector-based vaccine. That's an mRNA-based vaccine. And if you have India, if you are in India right now, just go ahead and take your Indian vaccine currently. Don't wait for any new vaccines to come in. The gentleman who is in South Africa, if he has a choice, of course, go for the Pfizer vaccine because that seems to have the maximum amount of coverage. But remember, even those vaccines have got some immune escape for some of the new variants which are coming. So nothing is foolproof. The only foolproof is that you take your vaccine and you wear your mask. That's the only foolproof solution.
Right, doctor. The next question is from Miss Haripriya. So my sister's C reactive protein is 8.7 mg per L. This was tested on 30th day after testing positive for COVID. Please let me know if this is a matter of concern.
So her sister is COVID positive. 8.7 is a higher level of CRP, but it's not very high. It's still in single digits. I would suggest that rather than looking at CRP, she should look at the symptoms of her sister. Do the 6-minute walk test. Look at the saturation. Do the temperature monitoring every day, and of course repeat the CRP in 3 to 4 days time. And most importantly, he needs to be in contact with one of the doctors every day and report her sister's health, or her sister can talk herself to the doctor so that they are aware of what is happening.
Thanks, doctor. Another question is, if a person has taken the first dose of vaccine and has had COVID post that, then when can he take the second dose?
3 months. 3 months after recovery, at
Okay.
least.
So another question is there a connect between COVID-19 and the incoming monsoons? Any kind of connect?
That's a very interesting fact because if you look at last year, we peaked around the monsoon time. Right now, we've already peaked in the summer time. So technically speaking, the Western world has peaked during the winter time. So it looks like it's an all season vaccine virus. It doesn't seem to favor one season over the other season. But but theoretically, in monsoon, when the humidity is high, you may actually have water droplets may be able to carry up COVID virus a little bit more longer and stuff. But it has not proven. It's not been proven. These are just theories which have been raised. I think we have to accept that this is all season virus and be protected against it all the time.
Right, doctor. The next question is from Narsimhlu Vandana from Bangalore. Post-COVID patient having severe left arm and shoulder pain and also chest pain. So after 1 month, after being tested as positive.
Please
So
do
do
an
we need to get
ECG.
the
Please do an ECG, Vandana ji. Please go and get the ECG done. Any chest pain with left arm pain should not be treated lightly. Please go and get ECG done and rest assured that there is no other problem. So first go and get your ECG done and show a doctor, please.
Thanks, doctor. The next question is from a doctor, Dr. Somsundaram. What is your view and experience in your hospital about the number of patients admitted with COVID after 2 doses of vaccination? Is there any mortality in these groups in India?
So Dr. Som Sundaram, what the question you're asking is about breakthrough infection. The breakthrough infection is defined as an infection which happens after 15 days of the second dose, which means that you've had your full immunity by the vaccine, whichever vaccine you've taken, been given to you, and you still had an infection. Yes, we've had patients like this. Fortunately, if you look at the patients who are admitted with breakthrough infection, they are very small number of them, and the mortality is less than 0.1% in this group. So, if you are vaccinated, the chances of dying are less than 0.1%. If people are not vaccinated, we know that the COVID mortality is around 1.5 to 2% currently in the country. So that means 1.5 people out of 100, that means around 3 out of 200 will succumb, whereas this is only 0.1%. And the admission rate is extremely low, just under 1% for these patients, this group of individuals. So vaccination prevents you from hospitalization, and most importantly, it prevents you to a larger extent from death.
Right, doctor. Another question is around post-COVID recovery. What are the chances of blood clotting? This is from Miss Mangle. And how can one avoid the same? How can one avoid blood clotting post-COVID recovery?
See, there are very few instances of post-COVID recovery blood clots happening. I don't think the Mrs. Bangle should worry about it. It is usually an acute phase which happens within the first 3 to 4 weeks, which can happen, and that's a part of the illness. Post-COVID blood clotting is very, very rare. There is no recommendation currently for people who are mildly symptomatic or who have been discharged from the hospital to continue taking blood thinners for a longer time. A short course of 7 to 10 days is what most hospitals and doctors would prescribe, and then we should stop.
Right, doctor. Doctor, could you give quick do's and don'ts for heart patients during COVID-19?
Okay, so quick do's and don'ts are heart patients should normally continue taking their medicines which they have. Secondly, they may find it difficult to do a 6 minute walk test, so they may want to short and do a 3 minute walk test. Third and most important thing is that any symptom which is giving you a shortness of breath or anything which is basically causing your oxygen to drop down at any time, do not treat it at home. Go and see your doctor and get admitted if you can. The fourth thing is that you need to make your diet in such a way that you're still eating a nutritious diet and having a good night's sleep. And the last but not the least is look out for your normal symptoms. Look out for your symptoms. If some of the symptoms are feeling abnormal, uh, do make a note of that and speak with your doctor about it.
Thanks, doctor. A question from Lakshmi Kishore. How does one deal with COVID, post-COVID stomach upsets?
There is nothing called as post-COVID stomach upset. It may be something which you have got, or somebody she knows has got. I think just normal restriction on your diet for a day or two. Just eat what can be easily digested. Which there are so many things which are our grandma's recipe, and you will be fine probably.
Right, doctor. Doctor, a question from Samiksha. How to clean the food items before consuming as a hygiene measure? Is it correct to still do the practice that we did during the first wave of sanitizing all the things that we brought home?
So fresh fruits and vegetables should be always washed with water, which I'm sure all of us do. Even before COVID-19, we did that. The rest of the things which I believe she's talking about is the packed things which we were sort of trying to clean up and sanitize. I think there is no harm in having a little bit of a cleanliness. So none of it has actually shown to transmit virus across. So generally, what I tell to my family is, this question comes to me from my house as well. I just tell them leave the things there for overnight. Next day morning, just use it as normal. So just whenever things come across, just leave it unpacked there for some time, and just next day morning just unpack it, and that's fine. Those items which need to be refrigerated can be washed with cold water or with water and just kept into the fridge. Rest of it can just stay there.
Right, doctor. I'm just going through the questions. I hope I have covered everyone. So, doctor, I think I'll conclude the session, and finally we'll end it with your closing comments. So I'll just thank everybody who's come in here. So as we draw towards the end of this informative discussion, thank you, big thank you on behalf of Tata Realty, all the residents, their friends and families, our business partners. Thank you so much, everyone who joined us from India and abroad. I really hope this session has allayed a lot of our fears, cleared a lot of our misconceptions, myths, and of course, Doctor, thanks, a very big thank you to you on behalf of the Tata family, and thank you for your time. It's precious, not just to you, but to everybody, all of us as a community. I'll sign off here, Doctor, and with your closing comments, probably you could end this, Doctor.
Thank you very much, Mr. Shap. I think my most important message to everybody is that please don't panic. Okay, I think panic causes us a lot of mistakes which we commit, and panic and fear petrifies us to such an extent that we start losing the sense of common things which we would normally do very easily. So if you can double mask yourself stepping out of home, mask yourself at home if you have a suspected patient or a positive patient, stay away from crowd, hand hygiene, and vaccine when your turn comes in, we are all going to be safe. Just remember, that we have to make masking as a part of our life for the next 16 to 18 months till the end of next year. If you accept that within your mind, you'll be fine. And kids, especially the younger kids, always follow the parents. So if as parents you set an example of wearing a mask, trust me, the small majority of the smaller kids would enjoy it. Of course, they will not keep it all the time, but they will also try to follow up what the parents are doing. About the kids, there's a lot of things been talked about the third wave affecting the children a lot. Trust me, if we just have simple things followed up, what we have talked about, you will not have a lot of problems as such for the children, and all our children will be safe. So, with this, I would like to just thank Tata Realty and Mr. Shah for having me around, and of course, Aniruddha, my colleague from One Realty. Thank you very much, all of you.
Thank you, Doctor. Thank you.